Hey everyone, today's video is about colds in infants. So I hope you'll find this helpful. It's probably going to be a quick one because we don't have a lot to offer for infants with upper respiratory infections. But let me just teach you a few tricks we do have. So babies can catch a cold just like any other person. In fact, probably easier because everyone they come across, they're going to catch. They have no immunity built up. So first of all, be very careful to prevent your infant from catching a cold. Don't let sick people visit. Make everyone wash their hands. Avoid crowds and large groups of people like shopping and family get-togethers and even the church nursery. Make sure everyone who cares for your infant has been vaccinated against the flu and Tdap. That's very important. But let's say your baby does have a cold and that's why you're watching this video. The few things that you can try are saline drops. Saline just means salt water, and you can place 1 to 2 drops in each nostril, followed by a bulb syringe to suction that out. In fact, you can leave the drops for a few minutes after you place them just to let them work. And sometimes they'll trigger a sneeze and the baby will get some of that mucus out on their own. So don't be afraid or worried about sneezes. It's actually a healthy, good, natural way for the baby to clear some secretions from the upper airway. There's also a device on the market now called the Nosefrida, and I have had lots of parents who swear that it's extremely effective and more effective than the bulb syringe. So if you are brave, it is perfectly safe to try the Nosefrida. It's a suctioning device in which you supply the suction, but there's a trap for the mucus, so don't worry, and it is supposed to be pretty effective. Saline drops, bulb syringe, or Nosefrida. The other one is you can elevate the baby's head. Now remember, you never want to put a pillow or anything soft or fluffy in the baby's crib or bassinet. But you can put a rolled up quilt or towel under the mattress, and that way you can elevate the baby's head a little bit, which can help relieve some of the nasal congestion. Another strategy is you can run a cool mist humidifier in the baby's room, and that can help with its breathing, especially for its throat not to be as sore due to mouth breathing because of all the nasal congestion. Now think about babies. They get all of their nutrition from liquids, so they have to either nurse or take a bottle. Well, they have to breathe during this, and if their nose is completely clogged and obstructed, they can have a difficult time feeding. This is one of our primary concerns for babies with colds, that they can become dehydrated. So you may need to offer more frequent, smaller volume feedings to keep them hydrated. Now, if you're nursing your baby, it's often very hard for them to make a good latch because they can't breathe through their nose. So you may have to pump and then divide the feeds into smaller volumes so the baby can tolerate it. The best way to monitor for dehydration in your infant is to count the number of wet diapers. Our goal is at least 3 urine diapers every 24 hours, so that's at least 1 pee diaper every 8 hours to make sure the baby's still hydrated. Also, you can look in the infant's mouth and it should be wet and shiny with saliva and not dry and white and sticky looking, and that's very important. Another thing I want to teach you about is what can happen with a baby with a cold. Most of the time it's just nasal congestion, cough, sneezing. They may be cranky because they don't feel well, just like we can be cranky when we have a cold. But sometimes colds can become more serious. So certainly if your baby's under 2 months and has any fever greater than 100.4 degrees rectally, that's considered a medical emergency. Even if it's overnight or on the weekend, you need to call your pediatrician immediately. That's important. Plus, if your baby shows any signs of actual respiratory distress, that's also a medical emergency. So that would be rapid breathing. No baby should breathe more than 60 times in a minute. So if your baby's respiratory rate is 60 or more, that's a problem. If your baby is having nasal flaring, where the edges of the nose go up and down, that can be a sign that the baby's oxygen level is low, and that deserves immediate attention as well. Also, if the baby has a repeated expiratory grunt, it's like this, because they're pushing against their glottis to expand their lower airways, that's a problem too. So flaring, grunting, or retracting is when the baby's breathing so hard, you can see its ribs coming up and down with the skin in between them sort of sucking in. That's a problem too. And in babies over 6 months, the use of abdominal muscles to breathe can also be a sign of distress. So increased respiratory rate, flaring, grunting, retracting, or belly breathing in babies greater than 6 months. All of these deserve immediate medical attention. And as always, remember, this is general medical advice, and your individual baby needs attention from your baby's individual pediatrician. That's very important. So we recommend preventing catching any of these colds by making sure everyone is vaccinated, careful hand washing, avoiding crowds, and then if they do get sick, saline, suction, elevation, and humidifier, and call us for difficulty breathing or decreased urine output. Unfortunately, I have really no true medicines to offer you. Now, if your baby's older than 2 months, they can have Tylenol for just the discomfort. If your baby's older than 6 months, they can have Tylenol or ibuprofen for discomfort or fever, low-grade fever. Certainly, if there's a high fever in any age, we would like for you to notify us. And the definition of high fever varies according to your baby's pediatrician. Now, after 12 months, babies can have honey, but not until then. And we don't recommend any sort of cough suppressant like dextromethorphan or decongestant like Sudafed until much older. We don't even use Vicks Vapor Rub until around 2 officially. So you can use the Vicks plugins, of course, and as I mentioned, you can use the Cool Mist humidifier. Now, many pediatricians do allow a plain antihistamine after 6 months, so consult yours about that. I will usually do some Benadryl based on the baby's weight if needed for excessive secretions, and sometimes if we can decrease some of the postnasal drainage, it helps with the nighttime cough, so we will do that. But there's not really many medications to offer. And in fact, some of those medicines, the decongestants and cough suppressants, can be quite dangerous. So be very careful and always ask your baby's doctor before you give it any medicines for a cold. Hope you found this helpful, and we plan to do another video on older kids and teens with cough and congestion as well. Thanks.